Hello friends, welcome back to our new video, that is MCQs on applied microbiology, and this is the part 3 of this series of videos on applied microbiology. Okay, so the first question is, diphtheria is transmitted through droplet mode of transmission, and so which other disease also has droplet mode of transmission and isolation of patient is done? So the options are pertussis, atypical pneumonia, TB or hepatitis B, and the right answer is option A, that is pertussis. So pertussis is a other type of disease which also has droplet mode of transmission, okay, and isolation from the patient. So move on to the next question on applied microbiology, that is, the causative agent of bacterial meningitis in a 1-year child include all except pneumococcus, Haemophilus influenzae, Neisseria meningitidis or Listeria, and the right answer is option D, that is Listeria. So this is the exception. So the causative agent of bacterial meningitis in a 1-year child include all except Listeria. Okay, so move on to the next one. So which of the following is not a biofertilizer? So options are mycorrhiza, rhizobium, agrobacterium or nostoc. And the right answer is option C, that is agrobacterium. So agrobacterium is not a biofertilizer. Okay. So next question क्या है देखेंगे. So next question is, all of the following causes hemolytic uremic syndrome except Shigella, Campylobacter, EHEC. EHEC means uh, that is enterohemorrhagic Escherichia coli or Vibrio cholerae. So the right answer is option D, that is Vibrio cholerae. So Vibrio cholerae cause hemolytic it is the exception which do not cause hemolytic uremic syndrome. Okay, but the other organisms can cause hemolytic uremic syndrome. Okay, so move on to the next one, that is vaccination causing intussusception, that is rotavirus or parvovirus or poliovirus or BCG. So the right answer is, sorry, another option is measles, and the right answer is option A, that is rotavirus. So what is intussusception? And intussusception means, so a life-threatening illness and occurs when a portion of the intestine folds like a telescope with one segment slipping inside another segment, and which is like this. So here this is the normal condition, but when one portion go inside into the another portion, here this type of things is known as intussusception. Okay, so move on to the next question. It is, relative bradycardia is uncommon in brucellosis, typhoid, malaria or factitious fever, and the right answer is option C, it is malaria. So relative bradycardia is uncommon in malaria. Okay, so next question देखेंगे. Next question is, commonest cause of nosocomial infections is Pseudomonas, Enterobacteriaceae or Klebsiella or all of the above, and the right answer is option D, that is all of the above. So commonest cause of nosocomial infection is Pseudomonas, Enterobacteriaceae, Klebsiella, all of the above. Okay, so move on to the next question, that is most sorry most common catheter related bloodstream infection is Candida, gram-negative organisms, coagulous positive Staphylococci or coagulous negative Staphylococci, and the right answer is option D, that is coagulase negative staphylococcus. So most common catheter related bloodstream infection is coagulase negative staphylococcus. Okay, so next question here. Zoonotic disease are all except leptospirosis, guinea worm, or rabies, or plague, or Japanese encephalitis, and the right answer is option B, that is guinea worm. So zoonotic disease are all except guinea worm. Okay, so move on to the next one. It is most common nosocomial infection is UTI, or surgical site, or lower respiratory tract, or skin and soft tissues, and the right answer is option A, that is UTI, that is urinary tract infection. Okay, so most common nosocomial infection is UTI. So move on to the next one. It is organism most likely associated with VAP, that is ventilator associated pneumonia, is Acinetobacter, Klebsiella, Clostridium, or Mycobacterium tuberculosis, and the right answer is option A, that is Acinetobacter. So Acinetobacter is the most likely associated with VAP. Okay, so next one is true about sexually transmitted ulcers include syphilis, where painless ulcer with rubbery lymphadenopathy, or chancroid, that is tender ulcer with suppurative lymphadenopathy, or genital herpes, that is painful ulcer with tender lymph nodes, and the last option is all of the above. So the right one is option D, that is all of the above. So true about sexually transmitted ulcer includes all these A, B, C. Okay, so move on to the next one. That is community acquired pneumonia is caused by Staphylococcus aureus, Legionella pneumophila, or Mycoplasma pneumoniae, or Chlamydia pneumoniae, or all of the above, and the right one is option E, that is all of the above are community acquired pneumonia. Okay, all are caused by, community acquired pneumonia is caused by all of these microorganisms. So move on to the next question. That is, which of the following agent disease combinations are correct? The first one is limes with Borrelia burgdorferi, or cat scratch, that is Bartonella, Hansel, or glanders, that is Burkholderia malay, or all of the above, and the right one is option D, that is all of the above. So all of these disease and agent combination are correct. Okay, so move on to the next question, that is correct combination of diseases and their incubation period. So first one is leptospirosis, that is their incubation period is 5 to 20 days. Hepatitis A, that is 10 to 50 days. Measles, that is 10 to 15 days, or all of the above, and the right one is option D, that is all of the above. So all of these disease and their incubation periods are correct here. Okay, so next question is diseases transmitted by tick, that is trench fever, tick typhus, or tularemia, or epidemic typhus, or both B and C, and the right answer is option E, that is both B and C is correct about the disease transmitted by tick, that is tick typhus or tularemia. Okay, so next question देखेंगे. So next question is best method of preventing further transmission in MRSA infection in wards. So and MRSA means methicillin resistant Staphylococcus aureus. So best method of preventing further transmission in methicillin resistant Staphylococcus aureus infection in ward is hand wash, antibiotics, autoclaving or incineration, and the right one is option A, that is hand wash. Okay, so move on to the next question. That is, Kayakalp award is given for hospital administration, hospital patient safety, or leadership, or environmental sanitation, and the right one is option D, that is environmental sanitation. So Kayakalp award is given for environmental sanitation. Okay, so next question क्या है? Next है, which of the following algae can be grown on wastewater, and the options are Spirogyra, Volvox, Spirulina, or Chlamydomonas, and the right one is option C, that is Spirulina. So Spirulina is an algae which can be grown on wastewater. Okay, so next question here. True about sandfly is or are: do not fly by choice, smaller than mosquito, breeding in overhead water tank, or cause chikungunya, or both A and B, and the right answer is option E, that is both A and B is the only correct answer. So they do not fly by choice or smaller than mosquito. Okay, so move on to the next question is, common organisms implicated in cystic fibrosis is or are Staphylococcus aureus, Pseudomonas aeruginosa, Burkholderia cephacea, or Haemophilus influenzae, or all of the above, and the right one is option E, that is all of the above. So all of the above are common organisms implicated in cystic fibrosis. Okay, so the last question of this video, that is, a patient developed hemorrhagic Ballow's lesion at the bite site following a dog bite. The most probable organism implicated is Pseudomonas, Staphylococcus aureus, or Capnocytophaga, or Vibrio vulnificus. And the right one is option B, that is Staphylococcus aureus is the right answer. So a patient developed hemorrhagic Ballow's lesion at the bite site following a dog bite. The most probable organism implicated is Staphylococcus aureus. Okay, so these are all 20 questions of this video. So thank you for watching this video.